Hi, everybody. Welcome back to another episode of BEqualise podcast. Hi, everybody, and hi to our special guest, Dr. Faisal Mubarak. Hi, Faisal.
Hello, Dr. Viviana Muti. How are you doing?
I'm good. Nice to see you again.
Yes.
As you know, Faisal is part of the BEqualise team, and today we're very excited because we are going to have our all sections talking about BPPV. And just to introduce you and tell you a little bit about Faisal and the story of BEqualise, we met a couple of now years ago with Faisal, and he is a physical therapist that has been trained in the US and is currently based in Saudi Arabia. And he has a huge experience, of course, in many sector physical therapy, but particularly in vestibular rehabilitation. Faisal, would you like to add anything else that we should know about you so that patients can actually maybe find you and reach out to you, your specialty? A few words about yourself.
Thank you so much, Dr. Vivi, and I'm happy to be here. Always happy to be part of this amazing team led by you, and it's a great journey. My name is Faisal Mubarak, as Dr. Mucci said, and I live in Saudi Arabia. I'm a physical therapist by practice. I practice physical therapy in different parts, musculoskeletal, orthopedic, and vestibular rehabilitation. I've been doing vestibular rehabilitation for many years, and I was honored to attend a lot of different courses, conferences, and giving speeches, attending advanced courses, and treating a lot of patients with vestibular disorders. And I'm happy that I was able to be part of their journey to get back to normal.
Thank you so much. Yes, Faisal is in charge of our movement slash rehabilitation protocols in BEqualise. And because it's one of our pillars in the application and also in the platform in general. So the pillars that we have are involving nutrition, movement, education, and mindfulness. But movement is a huge one. Today, we decided to dive into more knowledge, and specifically, we're going to try in the next episodes as well to focus on different pathologies. Today, we will focus on BPPV, which is one of the most common, unfortunately, vestibular disorders. And yeah, so you know all me, I think we should just move on to the introduction of today's topic. So, as mentioned before, we will focus on BPPV. Just maybe a few words, Faisal, if you would like to just explain BPPV in a simple terms that also patients at home can understand what it is, and if they had it, they can maybe understand what happened to them.
Sure, sure. So, as you said, maybe, I mean, you say the true, it's one of the most, but I can change one word. I would say it's the most actually common disorders and vestibular disorders. BPPV is a stand of benign paroxysmal positional vertigo. What that means is benign, something benign, you're not gonna die. Paroxysmal is something that comes sudden out of nowhere. Positional, it means that it's triggered by changing position. Vertigo means a true spinning sensation. So here is very important, a true spinning sensation. So we're not talking about imbalance or something that you are shifting gait. No, you're talking about actual spinning. So either you are still and the room is spinning, or the room is still and you feel like you're spinning. So that what spinning sensation means. So benign paroxysmal positional vertigo, as I said, it's the most common disorder in the vestibular system, and it's triggered by many causes. And until now, in the literature, it's been saying that there are known and unknown causes of PPPV. One of the most common causes of PPPV is infection. So a pure or a regular or whatever slight infection in the ear can actually trigger PPPV. Trauma can trigger PPPV. Aging process can trigger PPPV. All this can contribute to triggering PPPV. So what's actually happening in this, and again, the prevalence between male and female is is almost is the same. It's more in female than male. And it can affect all different ages. So there is
Yeah,
no
but
specific.
perhaps, yeah, maybe perhaps we should indeed say it's pretty much affecting everybody, but the age component, it's really important to consider it,
Yes,
right?
definitely. Yes. So the more it can affect all ages, but it's mainly affecting people with um, the aging
Getting older,
people.
yes,
Yeah. So
unfortunately.
yeah. So um, in this part for the vertigo, it's very you know something different. If you have not experienced, and I hope you're not going to experience this, but if you have not experienced vertigo, it's very important that you know what people are feeling when they experience this kind of BPPV, how scary it is, and how disabled they become. And in this part, it's very important for you as a caregiver to support the one who's affected, and also you as a patient, is very important that you know things that you have to know for you to do. So people are get frightened and scared. Go ahead, my friend.
Yes, sure. They get really scared. Maybe before we go into how difficult this is, and you mentioned rightly so, it's very tough to understand what happened from the outside because, as we always say, with dizziness and especially vertigo, you don't get it until you get it. It's such a debilitating, overwhelming experience. But perhaps before we're moving there, it will be nice for our audience to give them a little bit of the pathophysiology of what actually happens so that they have an understanding of how this is occurring. So maybe just few words for everybody to know, and then also Faisal can relate what I'm saying from a physical therapy perspective. So in the inner here, we have semicircular canals. These are basically making are part of our vestibular inner ear organs. And what happens is that whenever you have the so-called BPV, it occurs because there are crystals in these canals, in very simple terms, that they get out of place. And when they get out of place, they can elicit a sensation of spinning vertigo because they are responsible to usually move in this canal and send us signals about where you stand in space. So if I move my head, these canals are moving and they're sending a signal to my brain, say, okay, Vivi, just move the head to our left. But when they go out of place, that's kind of what happened in very, very simple, basic terms. So what happens is that when they get out of this, where they should be, so they get out of the semicircular canal, they are not in the right position, then you can get the spinning sensations, and you also get very strong nosogenic signals. So you feel like you want to vomit, you have nausea, and of course you lose the sensations on where you stand in space. So you get completely lost in simple terms. And this is absolutely frightening. Now, going back to Faisal explanation, this is crucial to understand what him and the physical therapists are usually doing, right? Because
Yeah.
it's crucial, right? So now that we explain how these crystals they go out, what they do, maybe you can carry on with this. What do you do then when this is happening?
Well, now, first of all, this part, the part that I'm going to talk about right now, it's not only done by a physical therapist, it can be done by a family medicine, ER doctor, audiologists, ENT doctors, definitely. So because they are the one who sees these patients right away. So people will go directly to ER or to outpatient setting. So in here, what we do, first of all, we have to clear out and to screen this patient from any other medical critical issues, such as any neurological issues, cardiological issues, things like that. So that's what we do, first step. Once it's screened, Then we move to according to the symptoms and signs that's happening to the patient. Let's say this patient is screened and having all the signs and symptoms of BPPV. So then we move to knowing exactly where this happening, because as my friend Vivi said, it's that we have canals in the inner ear. So we have three canals in the right ear and we have three canals in the left ear. So I want to know exactly where this crystal went exactly. So I want to know if it's in the right, on the left. If it's either ways, I have to know exactly in which canal. So once I examine them, I'm going to treat them. Why I'm saying that? Because there are many people think that there are only one type of examination for BPPV and there is one type for treatment of BPPV, and this is not true. There are different type of examining BPPV according to the canal that went to it, and there are different kind of treatment of BPPV according again to the canal. So some people would say, would come to us after they seen their doctors and they screened, and they say, doctor, we have done all radiology examination and nothing there, everything is normal. We've done all laboratory and everything is normal. My vital signs is normal. What's going on? I mean, what is this? And this is exactly what most people feel, because you don't in PPPV, you don't find anything in your radiology or laboratory or whatever. It's a clinical examination. By your clinical examination, the clinic, you would find the issue of, and the most important part, and maybe we've talked about this, Vivi, before, is the subjective examination, the history of the patient. You have to know exactly what's going on, how long this been going on, what are the parts that the patient affecting, and this will help you also in the screening, the first part we did. So once it's screened, let's say that it's in the right ear, we examine the right ear and we know exactly if it's in the vertical canal or in the horizontal canal. Once we know it's there, we treat it. How it's this treated, regardless of the types of PPV that I was talking about, regardless of the canals that I was talking about. What's the treatment of PPV is basically you bringing this crystal back to its home. So you bring it back to
Yes.
its place. Yeah.
Perhaps this is important to just mention more from a patient perspective. So if you've been to an ENT doctor and you still have this, I mean, usually it's very impairing and you should know if you have it. But unfortunately, I have witnesses that there are BPV patients that they get dizzy and they still, despite going to emergency, do not get the maneuver they require and do not get the treatment they require. And unfortunately, they continue being dizzy. So the main and the most important thing, as Dr. Mubarak just said, and strengthen it, is that you need to go to somebody that knows what he's doing, because it's complex. There are many different canals, many maneuvers, many ways to analyze you, many ways to assess you. So please, if you still, even if you went to the emergency, let's say, or if you know that somebody has been to the emergency and you still cannot figure it out, try to go to a specialist, try to reach to somebody that should be an expert. Because unfortunately, in my life, I've seen it and witnessed it many times. The BPV patients end up in the emergency and do not get, unfortunately, the care that they are meant to receive, because they don't know enough about BPV. But it's very common, BPV, so it can happen also to your family members. Actually, just on a side note, to make it a bit more personal, it happened to my mother when I was in Italy, and I
Oh,
was lucky
really?
enough at home. I was like, this is your luck, because I was at home. So yeah, it was at home, and she got the BPV attack, and it was really for her. Even up to now, she said, I cannot describe how crazy that was for her. She kept telling me, this is crazy. I've never felt anything like that.
Let me
But
tell you
yeah,
this.
yeah.
Let me tell
Say
you
again.
this. One day, I was leaving the clinic after a very busy clinic, and in my way to the car, I was thinking of what actually the patient are feeling. Really, I mean, because they come, they scream. Some of them they vomit, and this is a very important point to say here. The severity of it is different. So some people are less severe where they feel nausea and things like that. But there are people that are very severe where they end up vomit actually. So one day I was thinking of what's actually going on. I mean, how do they, what do they feel? And unfortunately, a week after, I woke up in the morning and I was up in my bed and I had this whoa, this kind of spinning sensation.
Oh
Yes.
my God.
Oh my God. I couldn't even recognize the time in my phone. I was looking at the phone and things like that. I couldn't read it. So it is crazy. Luckily, I treat myself
Oh my
on
God.
the bed.
This is crazy. But this is why sometime, if you have any family member, even if you're not directly a patient, but a caregiver, it's important to recognize these signs and to know promptly what to do. Okay, so moving on, tell us more. So you say, okay, the patient goes, let's say I have BPV, I come to you. What would be, you assess me and then you will treat me? Maybe explain a bit more from your perspective what a patient should know and what is the treatment of BPV involving, and what is your experience? Because my experience is that they are so afraid, they are so scared when you're doing this to them that you have to win the trust. So maybe a few words about that.
Yes, I mean, and I don't blame them actually. Imagine that you go to a doctor and you have a pain, and the doctor would say, "Look, I'm gonna press on that pain right now." He would say, "Why? I'm here for this. I want you to treat it." So, look, let's think of this now. We have first to know exactly what's going on. So as I said, once we clear all these medical causes, and we move on to the next step where I need to identify exactly what's going on. Unfortunately, I have to put you in the position that would make you feel this dizziness. But the good thing is that hopefully we will treat you right after that, so you're not going to feel this anymore. Second of all, it's not going to last a lot. So I want to know, so because people, when they come to the clinic, they think if I put them in the position, so how to examine this BPPV? We put the patient into different positions. So we make them long sit on the bed, and maybe to test the right, I would say look right, and then go back to the bed, and then or to test the left, look left, and then go back to the bed. And then these are for vertical canals. For horizontal canals, you have to lay down first and then bend your head and turn right and turn left. So these movements are simple movements. It will trigger this vertigo. But the good thing is we are here. I have to gain, as my friend colleague said, I have to gain the trust of this patient. I'm gonna tell you, I'm here, right here next to you, regardless of what you feel. Hold my hand. You would feel my hand. You're not gonna fall down. I'm here. I'm holding you. And whatever you're gonna feel, it's gonna be only a few seconds, and it will go. Okay, and then we will go right away to treatment, and treatment is different positioning that I'm going to do for your body to allow this crystal to go back to its place. So sometimes it doesn't take more than 5 minutes for the examination and the treatment altogether. And there are people that from the first session, a lot of people from the first session, they will feel different. Yes. So I have a lot of people. I do the examination, I do the treatment, and right away I retest, and it's negative.
I know.
So
And
yeah.
this is why it's very important, and we really want to strengthen this more and more, that at least you know the basics, or I mean, we really hope that this is going to become so popular in the future that everybody knows what to do with it, because it can be fixed and the crazy thing is that they are so poor and they feel so bad, and it can be fixed in such a short time, which is mind-blowing, because there are not many other diseases that you can just go and fix in few seconds, right?
Yes,
So this
yes, yes.
the magic of the BPV, very debilitating, very common, very annoying, but also very quick to kind of fix. So okay, one of the things, if you are a patient that have experienced BPV, and you have been lucky enough to get better quickly, that's great. But there are sometimes patients that this becomes reoccurrent, right? Maybe a few words about that. That's also something important for them to know.
Yeah, before we go to this, I remember something you said earlier, that if you are not specialized in this practice, I mean, do not touch these patients, because these patients are fragile, are priceless. It's just something. So don't touch it. It's very sensitive, and very important to know exactly what to do with these patients. So in terms of BPPV, there are different cases actually. And there are cases that can be done, and I mean that can be examined and treated in the same session. Usually, what I do is I see the patient, I examine them, I treat them, and I see them according to the case. To be honest, some cases I would like to see them in 2 days. Some cases I give them a week for their follow up, and that would be depend on different factors, such as, like, for example, elderly people, I need to see them right away. I don't want to make them wait for another week to come and see me, according to the severity of the case. So I treat the patient, I retest. If there is any findings, I retreat the patient again in the same session, and then I give them a follow-up appointment. So there are patients that would come in the next session saying that I'm fine, I'm good, I'm back to normal. There are patients that would come to say, I'm way better, but there are some slight, and I retest them again, and there are actually some slight symptoms, and we do the maneuver again, and good. There are actually patients with different pathology that can cause recurrency. I had patients who would come to me every 2 weeks with this issue. So one more thing to say about this is something that we tell the patient after they leave the clinic. Okay, so once the patient is we're done with the treatment, there are things that very important to say to this patient. One is try to be careful in the next 2-3 days. Okay, try to be balanced. Try to avoid any dangerous places, any 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 places where you're not supported or no one next to you. Why we say that? Because we just triggered the balance system in your ear. Even if we fix it, we just triggered it. So this trigger can cause this imbalance for the coming 2-3 days. And another thing we say to our patient is, you should expect, and you want you to expect that you see yourself imbalanced for the coming 2 days, because your balance system is regaining its own functionality. So these imbalanced things are expected to be seen, but we have to differentiate between an actual vertigo or an imbalance that they might feel.
Yeah, that's very, very important. And on top of it, sometimes patients are also telling me after they got BPV, I don't feel good when I go to supermarket, or I don't feel good when I do certain activity, or I'm scared of doing certain activities, or whatever. It is possible sometimes that BPV patients, they also then develop a kind of like chronic unbalance or unsteadiness. But this is because of the fear.
Yes.
Often it's because of the fear. The fear, because this event can be so traumatic in them to feel that you don't have a sensation of where you stand in space. Then after, you are afraid to do many activities. You are afraid of moving your head normally. You are afraid of doing things, and especially if you are elderly, then your balance system also starts to deteriorate because you do less and less. So one of the things that I always promote is like, yes, it might have happened, it might have been horrible, but now you're good. Try to go back to life, right? Try to
Yes.
go back in a safe way to move and to feel that you're okay. Because fear can be really impairing. I believe it's one of the biggest problems with systems, right? We talked about this also in an earlier conversation. Okay.
Yes,
Now,
especially with you.
yeah. So if we talk about what would you like patients with BPV to know if they want to go into the BEqualise app, and why? What do we try to do? Because it's an acute condition and we don't work acute mainly, right? You need to go see a specialist. As Dr. Faisal said, if you do have an attack, go to a specialist that can really help you. But what can we do to support you? In BEqualise is that we provided a lot of educational content and movement content to try to make you move more. And the reason why today I was really happy that Dr. Faisal picked up this topic because it's such a prevalent disease. I think if you have a big family, you will see it in your family, in the elderly, at least one member who's going to have it, right? So it's
Yes,
important that regardless, we spread the awareness to understand what's going on, that at least if it happens, you know how to react, you know what to
yes.
do, right? And anything else you would like to add from a patient perspective, like if you want them to know anything else on your hand that you think it's relevant for them?
Well, I always, assure, and I just want to know, I just want to tell my patient that whenever you have this feeling, I want you right away to go to a medical, to seek a medical care, to see exactly what's going on. If it's something critical, something that has to be taken care of immediately, or it's something related to the vestibular system. Unfortunately, as my friend said, if you happen to go to a place where you don't have people experts, so you screened for medical causes, but you don't find any expert in vestibular system. BEqualise is here to support you. BEqualise is here to educate you. BEqualise is here also to help you get the nearest specialist
Yeah.
that you need by going through the app and find someone next to you. And always we are here to help you with any, and even after your treatment, will there are different aspects according to your case that we might be able to help you with.
Yes, I think we have a couple of questions from people watching this. Let's see, maybe, let me see if I can open it. If I had BPV in the past, yeah, okay. We kind of answered before, but this is a very common question, again, because of the fear. If you had it one time, people are like, am I going to get it again? The answer is there is a chance always, of course.
Nice.
Yeah, right? There is a
Yeah.
chance.
There is a chance that it might happen as anything else. If you have a headache, you might have headache again. If you have flu, you might have flu again. But this should not stop you from, enjoying your life. So we treat you, you go back to life. Does not stop you from doing what you are doing, unless there are some other medical problem that is seen by your doctor. But this should not stop you. And whenever you have this feeling, you are always welcome to get back to us and help you.
Yeah, and the good thing, what I'm always trying to say, people that got it once, and my mother was one of those, when she had it, she said, am I going to have this again in my life? I don't want to have it again. I don't want to have it ever again. And I said to her, look, it can happen again. But the good thing is that if you know exactly it's the same feeling, the exactly same, because there are other pathologies as well that could happen and have, but I say if it's happening, it's exactly the same sensation, at least you know what it is. The main thing you can deal with is that, unfortunately, if it does occur again, and you are probably able to better manage yourself because you have been through this before. Let's see if there are other questions, perhaps, that we can just reply in the few in the what can I do to feel better overall? I guess this is about the holistic approach. I mean, if you had BPV, as Dr. Faisal said, your system goes through a little shock, right? You need some time also afterwards to get better. And this might be because of many aspects. The etiology of BPV is multidimensional. There are many aspects, but it might be that you can definitely try to look into, do you have an osteopenia or osteoporosis underlying? Check that with your doctor. Do a bone mineral density test. Do you have maybe you have a lack of vitamin D, or maybe you can do things in general to look at your nutrition, how you're sleeping, how you're moving, how is your mood. These are things that will overall help in these pathologies, as in most pathologies, right?
Yeah. I mean, holistic approach, lifestyle.
Yeah,
And
I
that's
agree.
what's unique about BEqualise. And I'm not saying this because I'm part of BEqualise, but seriously, that's what's unique about BEqualise, is we look at you as a whole body, as a whole body. You know, to know, because things affects, our body is very smart, and whatever is missing, other parts of the body will be affected. So we actually cannot treat something per se by itself. We have to look at everything around. We have to look at you physically, psychologically, mentally, nutrition, all this
All of it.
component.
I think we have one more questions, and then we can do. Hi, okay. Why more old people have BPPV? More women, sorry, have BPPV. Okay, I guess this is interesting just to explain a little bit. These crystals are basically, let's say that they are very similar to bones. Let's say like this. They're autoconia, like they are a part of our in the process. They share a similar compositions to what could be a normal bone, just for you to understand. So if you have an osteopenia or osteoporosis, which unfortunately many older women have, you might have a tendency to have more BPPV. And we know that women, when the estrogens are going down, are more prone to osteopenia, osteoporosis, because the estrogens have this protective effect. And so when that happens and you're getting older, your estrogens are lower, you're in menopause, you might get osteopenia and you have osteoporosis, or you're not very active in general, or maybe you're lacking some nutrients, and you're just getting really just aging. That's one of the theory why BPPV could happen. And
Yeah.
that's why women, unfortunately, when we get older, we change our hormonal profile and we get more prone to several diseases. That's it. It's bad to say that, but this is the reality. We can't say much more than that. Okay, I hope we give you a hint about BPV. Maybe Faisal, for us, just give us two summaries, one about BPV and one about you, and what people can do if they want to have an online consultations with you, where perhaps you can, instead of having proper physical examination, you can review their history, and you can still provide them with home training and home exercises. This is very
Yes.
important because they can reach out to you. So two things, the sum up of today, please, and about yourself.
Yes, definitely. The vertigo part is very important, as I said, first to seek for medical care to see what's going on. After that, you should find the specialized person who can deal with this. And again, it doesn't, it can be any practitioner, family medicine, ER doctor, a lot of different specialty can deal with this. But you have to have someone who is specialized in this and can actually deal with this. Unfortunately, there are places where they give medications for chronic, I mean for long period of time, and this can help only for a small period of time to suppress these symptoms, but does not treat at all what you have. So seek medical care to find out what's going on, find a specialized person, and things will be fine. For me, I'm always happy and honored to speak to any one of you. I'm here to help. Definitely, there are, I mean, let's say that you are in a place where you find that screened and nothing is going on, but there's a BPPV and you don't know, or any other vestibular issues that you don't know what to do with, please, you can reach out to me, to our colleague here in BEqualise through BEqualise, and we can definitely talk. We can talk. I can
Sure.
hear from you exactly, and this is a very important part to hear from you exactly what's going on, and we can go from there. Definitely, we can do a lot.
Sure. And we have a network, of course, of other specialists. If you do need medical care, we have a network of doctors that you can reach throughout the platform. But if you need just support, apart from BPPV, if you have any dizziness and you just want to understand if you can do anything also online, please reach out to Dr. Faisal and the other specialists on the platform, because they will be more than happy to help and support you. Okay, thank you so much, Faisal. I think this has given us great insights into BPPV, has been really helpful, I think, for many patients. And I would like to say to everybody that is watching, please leave comments and tell us what you want to see in the next episode, because we have a lot of things that we can talk about, but we want to know from you. What would you like us to discuss? And Faisal, I hope to see you soon. And that's it. It's fantastic.
Thank you so much. Thanks to everyone. Thanks to the team. And see you all soon.
Thank you so much. Thank you. Bye-bye.